Guess we're recording. And I don't know why my slides are ignoring me right now, but let me see if I can make this go away. Okay, continue that. Hide my controls so you don't see that big nasty box at the top. And there we go. Sorry. Now if I can go backwards. Okay, good. We're good. All right. So the objectives today. So what we're going to try to do here is discuss some of the challenges that can occur following a stroke, some of the things that you're going to be dealing with, some of the potential impacts of a stroke, and then also discussing aspects around the importance of acceptance. And I'll explain that more as we go on. And then we're going to talk about some various means of adaptive coping. So if we get this right, those are the things that you'll come away with, and I hope that you find them helpful. So talking about the impacts, I'm probably telling you stuff that you already know vastly more intimately than I can ever explain or describe. But I'd like to start with just kind of a conceptualization of what actually occurs with a stroke. And so if you imagine the development of the brain and neural connections and neural pathways, like there's a community that's starting up out in the woods. And in the woods, it's very difficult to get from one place to another because there's all this brush in the way and a lot of trees. And so you start off by just hacking a path through the bush to get from point A to point B. And point B might be the watering hole, and point A might be the kind of shaded area where we feel safe building our home. And so that's a path that initially is just going to be kind of hacked out of the bush. But as we keep going back and forth, now suddenly we start to widen it a little more. And as we keep going more and more, we're trudging down all this brush. And then maybe we put down some gravel or stones. And then now if you come to modern day, we would actually build a road and then maybe even a super highway between there. The more and more that we're using it, the more important it is that we're going back and forth between these 2 points. What occurs with a stroke or any real neurocognitive insult is it's like if you imagine that super highway and someone bombs it right in the middle, just blows it up. That road is clearly going to be impassable. It's going to be hard to find a way to get through there. There's going to be rubble everywhere. Things are going to be blown up. But what happens is, do we just give up? We're not ever going to go back to that water? No. So what happens is we start hacking around the bush again, forming other pathways around this big wrecked hole. And eventually, over time, those new paths start to get reestablished. And now we put down some gravel and another road gets paved. And so there's a time in between there where our access from one point to another is going to be very impacted, and we're going to have a lot of problems, and it's going to take some time. We're going to need patience. But eventually, these compensatory avenues, these other roads around, start to get established, and we are able to have that connection. It may never be as direct and as fast as it was. Maybe it isn't a super highway, but there are a couple different roads that can help us to get there. And so we're still able to access these things. It just looks different. And so that's kind of my kind of quirky conceptualization, because I love to work in metaphors, for how this works. Because when we have our brain and we start to learn things, like as we're infants trying to grasp stuff, if you think of a child trying to grasp a cup, it can take a while for them to finally get that fine motor ability where they can grab it and pick it up and put it back down. When we have a stroke that impacts that specific area of the brain, we can have problems with coordination and grasp. And so we have to kind of learn to retrain. And so what occurs in our brain is this process called myelinization. And that's essentially the paving of the road. It's like the more often that we have these neural networks that are used, the brain knows and says, this is kind of important. We should put some myelin sheaths around this to protect it, to make sure that it still works. And so when we start out and we're trying to find new ways to do these things, it's little tiny neural networks that are connecting. And then eventually over time, the brain says, oh, let's myelinize that. Let's make sure that's protected. And as it gets protected, the currents actually speed along faster. And so that's why when we're talking about, if you're engaged in physical therapy, any sort of rehabilitation stuff, it starts off and it feels like such a foreign activity. It's best to think of that as you're now forming a new road. You're hacking through the bush again, but in time, your brain is going to pave this path. It's going to get faster. It's going to be more effective. But anyway, that's my whole spiel on what really happens in a stroke. And so talking about some of these impacts, it's going to vary. there's no one size fits all. And the reason that they'll vary is it's going to depend on the location of the stroke and the severity. And so you can see any number or any combination of these things. When we talk about physical impacts, we're looking at hemiparesis, which is, either some paralysis on one side of the body, lack of coordination, balance might be off, there might be some weakness, maybe really bad headaches. And then if we're talking about language, we're looking at like dysarthria, where you kind of get that slurred speech component, or there might be some problems searching for words. And this is actually something that we're starting to see right now, interestingly enough, in long COVID patients. A lot of the symptoms that they're experiencing are very similar to a mild stroke type experience, where we're having expressive language deficits, attentional issues, executive functioning deficits. So that's just an interesting side note. But also sometimes receptive language, where it can be a word you've heard 1,000 times, but you're just like, I don't really know that word right now. Or you might have someone that's using neologisms, so they're making up words, like instead of calling this a cup, it's a thingamabob. I don't know what that is. And so these are all issues depending on the localization of the stroke. As far as cognitive impacts go, we can see sometimes memory deficits, attentional issues, where someone used to be able to really focus and even multitask. Now it's a Herculean task just to focus on, even me speaking right now can be difficult. And if anybody were to walk in the room or a door shut, whereas before you could have probably blocked that out, now it'd be like, what is that? Who's over there? When we talk about executive functioning, if you've never heard that term before, it's probably one that might have been brought up by now. Executive functioning is the ability to schedule and plan and block certain things because you have to do other things. Some people might have an inability to drive because driving has an awful lot of cognitive demands. And I think that anyone who's driven anywhere can assess. There are a lot of folks who don't have all those abilities anyway, but they're still out there driving. But when we have a significant cognitive issue, our ability to block out certain stimuli, focus long enough, and then the coordination, all these pieces that are necessary might not be there. So we might have difficult discussions around not being able to drive. Additionally, for some people, around that executive functioning piece is impulse control. And for some, if the damage is more prefrontal, then we can see an uptick in impulsivity. So someone who, just wants McDonald's, but they know it's not good for them, and they just wind up going to get McDonald's all the time, or maybe even sexual impulsivity. Certain inappropriate behaviors can come out in the wake of this sort of thing. So these are all kind of the cognitive things, and then emotional impacts. These are some really devastating issues. Sometimes there can be difficulty controlling emotions. It's not just the difficult emotions around what happened, but you might just find yourself watching a movie and just sobbing uncontrollably, or even in the absence of a movie, tearfulness might just come on, and you're like, I don't even know why I'm crying, but I'm crying. So, or even anger. Sometimes we have a lot of difficulty controlling that. And then as far as emotions, there can be a sense of a loss of independence, might feel overwhelmed. There might even be a little bit of distrust in people, and just overall sense of fear. So obviously all these negative things, I wanted to get these up front, get them out of the way, then we'll move into more positive stuff, I promise. But not yet. So looking at the psychological impacts, these are important to discuss because as we're going to get to later, it's very important to acknowledge these things, because if we try to just dismiss them or bury them and just shove them down, there's going to be more problems long term. So we want to acknowledge these are all reasonable responses. And I think that in America, we have this tendency to view negative emotions as inconvenient or inappropriate, or we shouldn't have them. And the reality is they exist for a reason. They're there to inform us about our life experience. And so anxiety around a stroke is very understandable, because you've just had this bomb go off in your abilities. You are now a different person today than you were yesterday in terms of abilities and what you can do in this moment. And so there can be fears around the loss of abilities. Is this ever going to come back? Am I ever going to be the same as I was? worries about the future in terms of, I had this stroke. Is there another one coming? Am I more likely to have more? And the answer to that isn't always simple. And anytime that we have a lack of clear, concise, direct information, fears and anxiety really can boil up. And I think that we saw that very clearly over the last, year and a half of the pandemic. The void of solid and consistent information as it kept evolving and changing as we learned more really destabilized a lot of people. And so a stroke is a very similar situation because nobody can say with 100% certainty what is going to be recoverable, what is going to be the future course. And so anxiety is a normal response to that. That is not a problem. And it's important to just be able to acknowledge it and realize it and say, hey, this is a reasonable response. This is a big deal that I'm dealing with. Depression, that is obviously something that can come out, especially in the more severe strokes, because if you're needing the help of your spouse or family members, or you have to have a live-in aid or something like that, you can start to feel less than, is kind of the term that comes out and gets used a lot, and almost feel like a burden to others. And the reality is that depression is this self-feeding animal. And I use that term because it's like something crawls into you and takes over and says, okay, that good feedback, we're going to block that out. We don't want any of that. That's not convenient for me right now because I'm in this deep, dark place and I can't have rays of light making it through here. So I'm going to magnify this one little mistake or trip or slip up of words that I had. We're going to welcome that and say, yep, that's me. I'm a mess now. I can never be right again. When everybody makes little mistakes, everybody has accidents, everybody has things that just go off that aren't planned. But when we're depressed, the spotlight gets put on those and the positive feedback of others gets steered through this lens that says, oh, they don't really love me. They're just doing this to make themselves feel better. Oh, this is what's expected. Oh, that's what they're supposed to do. And this is not accurate. And so it's important to recognize and identify and call out the depression, because otherwise it really does have the potential to take over and steer everything that we're seeing. And when we talk about anger and irritability, anger is a secondary emotion. I'm not sure how many people know that, but everybody thinks like, oh, anger. Yeah, I get anger. That's an emotion. It's a secondary emotion that's always fueled by either sadness, worry, fear, embarrassment, guilt, shame, frustration, all those really kind of icky emotions that just sit on us. Because if you think about all those emotions, what can you really do about them? Nothing. They are negative emotions that really just sit with you. Anger comes out and shows up as like a, hey, I'll handle that negative emotion. Let's just get really mad and throw something or break something or yell at somebody. And we feel active in that moment. And it's when we're stuck with those passive negative emotions that even an angry response feels better because it's like, well, there, at least I discharged something, I did something. But the reality is that a lot of times, like, you wind up smashing your phone or something. Now that's a lot of money you got to pay. So now you feel more upset. You yell at someone that you love, you treat them really poorly. Now you have more guilt because you feel worse about what you did. So anger, we don't want to act on anger. We want to acknowledge it. Take the time to look underneath and see, what am I really feeling right now? Acknowledge that, own it, and address that rather than acting out in anger. But if you have some prefrontal cortical involvement in this, in your stroke, then you can see things like mood swings and really a lot of irritability and kind of snapping. And so these are very understandable things. Each one of these they can be very detrimental to your overall progress, to your relationships, to your support, if they're not acknowledged and if they're not addressed. So I point these out because they don't have to be doom inducing situations. These are things that if you're aware of them, if you acknowledge them, we're going to get into that. We'll talk all about it. But it's important to be able to be aware of these things so that they don't own you. You have them and you can address them. And so I talked in the beginning about acceptance. And I think that this is one of the biggest challenges around any sort of neurocognitive impact, strokes especially. Because we, as humans, have a tendency to want to deny and say, no, that's not it. And for some, an actual presentation of their stroke is something called anosognosia, which is where you're not even aware of the deficits. People point them out to you and you're like, I don't see that. I don't think that's true. And so it's a lot about raising awareness. What are the deficits? What are the impacts? And learning to accept those. And I know that that sounds bad, but once we accept them, that's where the healing process can really begin. Because in the absence of acceptance, we're living this false life of denial, and that doesn't help anyone. And so when we can accept it, it doesn't mean we have to like it. It means we accept it, we own it, and now we know what we've got to work with. And when we recognize, looking at the healing and recovery process, time is on your side. And what I mean by that is we've learned that the brain is incredibly resilient and works to heal itself far longer than we ever previously thought possible 20, 30 years ago. And so recognizing every day is another chance and something else may come back. And there's going to be good days and bad days. And it's important to really grab onto those good days and not magnify the bad ones. Just look at those and say, like, I'm a Cleveland Browns fan. Baker Mayfield had a terrible week last week. I'm not going to own that. Can't. Doesn't do anything for me to just say, yeah, he's terrible. I have to hope that he'll be better next week. Anyway, in more severe cases, when maybe this is a fourth or fifth stroke and there's some significant impact, then it becomes important to look and maybe at times there can be healing that comes around grieving the loss of one's former sense of self and their identity. And that sounds very dark, but what it actually is, the real benefit that comes out of that is that you stop beating yourself up with unfair comparisons and trying to reach back for something else. And an exercise that I use in therapy a lot of times is I ask people to clap their hands 10 minutes ago, but do it right now. And everybody looks and goes, huh? What? Because you can't. You cannot clap in the past now. And that's what a lot of people, that's kind of the fuel and the root of depression, is looking back, wishing there was something that could be different from here and now. And what that does is it prevents us from appreciating what we have and what we are right now and working actively in the present because we're so busy looking back in the past. Now, that doesn't mean there isn't value in appreciating and enjoying good memories of the past. But the more that we try to cling on to pre-morbid abilities, we're losing the ability of identifying what are our strengths now? What do we have that really can sustain us in the present, and emphasizing the birth of a new identity. I had a patient that I worked with back in the cognitive retraining facility who just struggled so deeply, and it was tearing his marriage apart because he was just so angry and bitter and critical of everything that he couldn't work anymore. He just wanted to work. And so when we finally got him to look and recognize and realize, hey, you're fine financially. You have insurance, you have things in place that'll sustain you and your quality of life. Your wife still loves you, wants to spend time with you. And we got him to recognize that now he could actually enjoy her. And they reoriented their entire marriage, and they started taking trips and started having fun, started enjoying the things he'd worked so hard to amass. And so he got to kind of really mourn the loss of that working identity, but then he got to reap the benefit of all that he built for himself. And so that's the kind of transition that we're looking at. And that isn't the story for everybody, but it's about looking at what you've got and looking at, this is where we are now. This is my reality currently. Let's make the most of it. And when I talk about compensatory tools or strategies, this picture here, if you see the woman, she's shopping, she's got her phone there, and there's nobody else on the aisle. And the reason I use this example is when we talk about compensatory tools and strategies, it's little helps, little things that can help us to, it's kind of like if you break your leg, you use crutches. You have to use the crutches until you're able to walk again. And so if you have attentional problems and executive functioning problems, where if you try to go to Walmart or the grocery store, there's so much noise and stimulus and so many shiny, bright colors and things that you can completely forget why you're there. You can get overwhelmed and not find a single thing. So the reason I use this picture is I've had patients do this where they now go grocery shopping with their phone where they have their list and they can delete everything as they get it. So that way they know what they've got. And they go in off hours. So it might be after, after 9 o'clock at night, it might be early in the morning, might be, sometime when you can identify that the store is not going to be as full as ordinary. And so these are tools that you can use that are going to promote success. And what happens is when you succeed, that provides immediate positive feedback. It lets you know, hey, we did it. It wasn't exactly the way we used to do it, but it worked. And then that immediate positive feedback can cause a lift in mood. And it also gives you a sense of mastery and accomplishment, which reinforces the use of these techniques. Because in the beginning, you might say, I don't want to do that. But once you go and try it, and it's not just this one thing, this is just one example, but there are so many myriad compensatory tools and strategies that can be used for all different types of impacts. So the more that it works, the more likely you are to keep doing it. And then the more you're able to do things, and then you feel better about yourself, which it's a nice cycle. Here's some tips to kind of help with coming to acceptance. Number one, the biggest one of all, is to avoid black and white thinking, this all or nothing. A lot of folks in the wake of a stroke or neurocognitive incident just look at, I'm not who I was. That's it. I'll never be the same. And it's these big, stark statements. And the reality is that if we can look at 80-20, the 80-20 rule, which is where instead of looking at black and white, we're looking at gray. And gray can be whatever you want it to be. And so 80-20 is to say, all right, you may not be 100%, but are you maybe 70 or maybe 80%? Are you more than half? And if so, that's great. Let's go with that. Let's work. Let's build on that 80. Let's not just beat ourselves to death with 100 or 0. That's not how this works. Another thing is preparing for the worst and hoping for the best. Again, that's me as a Cleveland Browns fan. I expect us to lose every game somehow, but I hope that we win, and sometimes we do, and that feels really great. Similar thing here is, as long as you're prepared for something to go wrong, then when it goes right, you're like, oh, well, that's pretty cool. That works. And it really makes that 80-20 come out. It's like, hey, I see the 80. This is pretty nice. And then this next one, these are all different takes on the same thing, which saying things take time, one day at a time, or the tortoise and the hare. It's about recognizing, when I gave that analogy of the bomb blast, there's time. This stuff doesn't happen overnight. We learn all the abilities, whatever it is that's offline in that moment. It took a long time to form that. It can take a while for it to come back. Be patient. Trying to rush things and trying to be really mean to yourself and just dogpile on every problem isn't helpful. So we really want to look at just being patient, recognizing this is a process, hoping for the best, and keep moving forward. Now, when I talk about here psychotherapy for the individual, I think it's almost essential that someone who is struggling in the aftermath of a significant stroke have an individual therapist. And I love if they have experience in either rehabilitation psychology or some experience working with this population, because it is a unique area of practice. It's an experience that not every clinician has, and you don't want to wind up with the wrong fit because you're just going to wind up frustrated long term. So I highly recommend trying to find some sort of a therapist with information and training in this area, because they can make a world of difference. They will have compensatory skills and strategies that you could never imagine that will make 100% difference. And they also have the empathy because they've seen it. And a lot of times they can give stories. And along that line, I think support groups, like stroke survivor support groups, are really great, because the way that the groups work is you've got new people coming in and you've got people who've been there for a while. And so the people who've been there for a while look really good to the people who have just shown up. And so they get to kind of model and mentor one another. And the ones who are further along get to look back and see someone, and it kind of reminds them from whence they're coming and the journey, the path that they've made, the progress they've made to get to where they are. So I applaud both of those. And then also for the family and caregivers, I think it's very important that they also engage in some form of psychotherapy, because it's great to have a place to just process feelings unhindered by any outside responsibilities and stresses, no demands, because people talk to their friends, they talk to their family. It's just not the same. Therapy is a unique relationship that is really focused on you for the entire time. And that's what matters most. And the other thing is, whenever I work with couples who have some sort of either health issue or neurocognitive issue, where one starts to become kind of a identified caregiver, I really emphasize being very cautious around that, because you have to remember why you're doing what you're doing. And it's the connection, it's the love. Don't lose the love in this caregiver role, because the balance in differential becomes very difficult to juggle sometimes. Uh, Basically, it's like the power differential, not balance differential. And so when someone is caring for someone else, the one being cared for starts to feel like a burden, like a hindrance. And that's not the case. The one that's taking care of them is doing it because they love them and because they want to help. And so it's important to make sure that you're connecting, that you're just spending time together that isn't around care. And I can't emphasize that enough, because it's it's kind of a needless additional problem to deal with. And the reality is, as long as you're using open and honest communication and communicating your love and your feelings for one another, you can weather the storm, I assure you. So now we're going to shift into talking about some adaptive coping skills, some of the things that can be helpful. And I could read this list, but we're going to do each one of them. So why bother? Let's just roll. All right. So acknowledging negative feelings. This kind of comes back to what we started talking about. And I love to quote Carl Jung, one of the big daddies in the world of psychotherapy. And he said, what we resist not only persists, but will grow in size. And that's a powerful statement if you really think about it. Resistance to acknowledging a negative feeling, it produces distress through this internal battle. So it's not even just about what you're dealing with. Now you have this battle over the reality and this deluded idea that it isn't there. And so it doesn't really impact the world, but it impacts you. And the feelings that can come up can be very real and very impactful. And it takes cognitive energy to engage in this. So acceptance allows one to shift away from these negative emotions and get to a more peaceful and grounded place. When we accept, we're able to then say, okay, let's get to a place where what's next? What are we going to do with this? And over time, that repressed emotion, whatever it is, the frustration, the anger, the irritability, it's going to emerge in less pleasant ways. Whereas if you're pushing it down, you're going to see it come out in things like friction with family members or friends, maybe even coworkers. Some people turn to maladaptive coping, like substance abuse, overeating, and just angry outbursts. These are not things that are going to help in this situation. So you can really diffuse a lot of these by just being real and just acknowledging and just sitting with these negative feelings and saying, okay. And the most important part here is it allows a shift from this kind of defensive and passive avoidance where you're just tiptoeing around and not calling it out for what it is. It allows you to shift to a calm, active engagement. And if you think passive versus active, which one's going to make you feel better? It's almost always going to be active. And the biggest thing here to take away is it's a shift from problem focus to solution focus. And I can't emphasize the importance of that shift enough, because looking at what's lost, what am I not right now? What can't I do? That literally is just fuel for the fire of depression and anxiety. Solution focus is, okay, this is what I can't do. These are the problems I'm having. What am I going to do about it? And that's something where your therapist can really help you to get into that active mindset, help to identify little incremental goals, get those compensatory strategies, and find the way to move forward. Deep breathing. So I can't say enough about this. This is one that throughout the pandemic, I feel like I was the preacher of deep breathing. But it's arguably, this is the gold standard of coping skills. It's effective against so many things. And the reason that it's effective is that it interrupts either anxious or angry responses. And I don't actually have my fun slide on HPA axis because it's just too much. But anyway, the HPA axis is a fancy word for the fight or flight response. And so the reason that we get angry or anxious goes back to our old caveman days when something was coming to eat us or we had to go kill something to eat it. And so when we're upset, being angry or upset about stuff around a stroke, that's going to be there a lot of the time. Not like a saber-toothed tiger that comes around once in a while to eat us and we have to respond. And so the chronic nature of anxiety and anger, when we get this deep breathing going on, which you see she's got one hand on her chest and one hand on her belly, that's to make sure that you're breathing right. I know you didn't think there was a right and wrong way to breathe, but here we go. Diaphragmatic breathing is where your hand on your belly should be the one that moves more than the one on your chest. That shows your diaphragm is expanding down and allowing your lungs to really fill with richly oxygenated air. Whereas if we're breathing up here, this is anxious breathing. When we're taking, it's not getting good oxygen and it's just going to start to make you dizzy and feel weird. Nobody wants that. So when we do a deep breathing exercise, it looks like you take in a deep breath, hold it for a 4 or 5 count, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, then slowly exhale. And then important part here, wait until you feel the need to breathe again. Don't force another one. And then when you have to breathe again, another deep one, hold it for a 4 or 5 count, slowly exhale again. I feel great. Anyway, you do 2 or 3 of those. I call it natural Xanax because it really produces the same response in your brain as Xanax, but it's not habit forming or addictive. So what it does, the reason that we do this is it interrupts the cycle. It allows whatever's there of your prefrontal cortex to come in and get involved and interrupt the emotional response, which is back in your mammalian brain, the limbic system. And that's fancy words for saying your dog or cat brain. If any of you have a dog, you leave the house, you come home after an hour or so, what's the dog like? Body's going nuts, shaking, excited to see you. That's the limbic system. That's your emotions. That's what we have inside. And then we have this prefrontal ability that when we have someone come home that we love, we don't necessarily shake our whole body, but we say, oh, great to see you, hi, which is more socially appropriate as humans. But anyway, so when we let this prefrontal cortex engage, it can stop this emotion-driven response and allow us to have a little bit more of a rational response. It allows us to actually respond more as ourselves, and we're not so much reacting as we are responding. And that's an important differential to make. And it also sends brain signals to your brain because we have these little neuroreceptors in our lungs that tell how we're breathing. They go directly to our brain that tell us, oh, that alarm wasn't necessary. We don't need to fight or flight. There isn't actually a saber-toothed tiger here. Everything's fine. It also downregulates the central nervous system. So when we're feeling active, really on edge, deep breathing chills all that out, lets us calm down. And as we talk about, in this day and age, stress all the time, the system is just kind of running with anxiety. If you're engaging in deep breathing through a meditative practice, which I encourage all my patients to do just 5 to 10 minutes in the morning when you first wake up and 5 to 10 minutes at night before you go to bed, you don't need to look like these people. I put these little Zen poses in here because it's what people tend to think of when they think of meditation. But I put them there just so you do not have to do that. You can just sit in a chair comfortably, lie in your bed comfortably, kind of propped up, do 3 or 4 of those deep breaths, and then just keep breathing normally. And try to just block out the noise of the day, block out all the negative statements, block out all the crap, and just Zen. And there's a lot of apps out there that can help guide you through it. But meditation really allows us to, it actually creates a place for our brain to kind of work on itself. So it really goes hand in hand with recovery. Exercise. So exercise is fantastic. And for anybody who has physical impacts of the stroke, when I'm talking about exercise, it's as simple as either you could do like chair yoga, you can do just a short walk, anything, 10 minutes is it. And if you do that once, maybe even twice a day, huge difference. And when we're exercising, if we're doing something like walking, which maybe initially we're in rehabilitation, so we're doing it with the guidance of a physical therapist, then after maybe we're doing it with a friend or a family member, and then eventually we're doing it on our own. But the point is, each of these steps is a reflection of ourselves that we are working to recover. We're working to get better. And every little bit of practice, we're working on myelinizing those pathways, getting these things back in place and releasing these endorphins, these feel-good chemicals in the brain. And it also provides, and this is another one of those, immediate sense of accomplishment. The more immediate feedback that we get, the more likely we are to keep doing things. And it gives you a boost in self-esteem. And then the little side effect here is that it also will make you a little sleepier later in the day. That can make sleep more likely. And also, if you're exercising in any way, it also helps you have a desire to eat a little healthier, which leads us to, hey, another great adaptive coping skill is a healthy diet. So stress, so anxiety and depression, these are things that can make us crave fatty, fried, sugary foods, which apparently means that I'm stressed all the time or depressed because I kind of love fried foods. But anyway, that's a whole other story. But those foods do not make us feel better. They're like short-term fixes, but long-term, they're really not good for us in any way, shape, or form. But the reason that stress and depression make us reach for those is it's the same caveman processes around fight or flight. Back when we used to get stressed, it meant that we were about to get eaten or that we couldn't eat for a long time. And so we wanted to grab fatty foods and things that were rich and stuff so that we could pack on the fat so we could go a while without eating again. We don't need that nowadays. We have plenty of food. Anyway, one of the big tips, staying hydrated. Be sure you're drinking your water every day, especially when we're working on hoping for our brain to do anything. Our brain is so much water. We gotta give it water. Obviously not too much, but there's 8-ounce glass of water per day is what we're recommended. But you know, that is a lot. You'll see if you try to do it, it's like, God, that's a lot. And you spend half your time drinking, the other half peeing. But either way, it's very good for you. And then there's something called a Mediterranean diet, which is very high in fish, some lean meats, nuts, beans, fruits, and vegetables, and certain oils that's been shown to produce a significant drop in depression. There were patients who were put in this study who had tested as having clinical levels of depression. They were given no medication, no therapy, just this diet. And at the end of 2 months, I think it was, they all had a statistically significant drop in depression just from the diet. And we're starting to get new information about neurotransmitters that are found in our gut. So it's kind of crazy, like how interconnected that our food and our diet is with our wellness and our sense of how we feel and our emotions. So anyway, feel free to read up on that. It's very exciting stuff. But also when we have poor nutrition, it's a very complex relationship with our poor mental health. It impacts our body image. It's a communication to ourselves. You know, when somebody said you are what you eat, they're not exactly wrong. When you're eating crap, you kind of feel like crap. And there's also a certain socioeconomic impact and also depressive confirmation that if you're depressed and you eat crappy food, it's just one more opportunity to kick yourself and say, look what you just did. We don't want to fuel that. So, you know, take care of yourselves with good, healthy diet. And then restful sleep. I can't emphasize this one enough. It's essential for neurodegenerative processes in the brain. When we're asleep, our brain does so much magical work on itself, preening things that we don't need, you know, repairing, myelinizing, all those things we want it to do. So sleep is great. It fosters mental and emotional resilience. When we have disruptions in sleep, we can studies show that we have enhanced negative thinking, more depression, and more anxiety. And when we're talking about like, how do we get good sleep? Okay, well, number one, stay off the screens, these things, anything, laptop, all of it, for at least an hour before bedtime. Also, only use your bed for sleep and sex. That's something called sleep hygiene, because we've learned that our brain pairs things. It's like this fabulously intricate machine, but it loves to match things. So when you're in bed, it should expect one of two things: sleep or sex. If you're doing work in bed, then now it thinks your bed is an office. That's not good. And as far as sleep or sex, it becomes really clear when you first get in bed which one of those is going to happen. So don't think that that's going to blow it. If you're like looking for sex and it's just not there, good, go to sleep. Anyway, and sometimes sex before bed, fabulous to help you sleep, but that's a whole other story. Um, Try meditating for 10 minutes. Like I said, sometimes somewhere in that half hour before you go to sleep, that really down regulates everything. Something else that's helpful is to take a shower before bed. It actually lowers the body temperature when you come out, and studies show that when we're a little bit cooler, we're a lot more likely to just lull off to sleep. So that's good too. Avoid eating within the hour before bed. So basically, if you're one of those people that lays in bed eating fried chips, watching TV right before bed, you're not doing yourselves any favors when it comes to sleep. That's like 3 checks in the wrong direction. So don't do that. And then also, reading a book or talking to someone in your home before bed. Imagine that, talking. So these are all good things to help you to get to sleep faster and to sleep better. So the other tips here, number one, give yourselves credit. I think there's so much tendency and temptation to just become self-critical and want to dogpile and beat yourself up. Nobody's perfect, and there's no single right way to get through this. So whatever you're doing that's working for you, as long as it's not hardcore drugs and rampant sex with strangers, you're probably going to be okay. But I think that if you're following all these things, these are all helpful tips. And it's about giving yourself credit, giving yourself a pass, and understanding that this is going to take some time and it's worth it. Do the work. Do your best. That's all you can ask. And every day is another opportunity for growth and development. And then also try to find the positives in your situation. And sometimes that's a lot harder than others, but I bet you there's at least something to be grateful for in your life. And when you can find that and be able to really own that, that's a big positive. Also, check in with yourself and know that it is okay to not be okay all the time. And then the biggest one here is that if you've tried all these coping strategies and you're trying to engage and you're still coming up at a loss and you're getting to the point where you're starting to feel like hopeless and helpless and thinking, what's the point? It's never going to be right again. That's when I really encourage you to reach out to a professional for help. Call 911, get somewhere, take care of yourself, because suicide is a real risk in this situation, and it doesn't have to be that. There are several things that are available to help and to support you through this, and you're not alone, and we're here for you. So by all means, reach out and consult us, okay? And also, that's it really. Thank you so much for having me. I assure you that it might at times not seem like it, but you guys, you got this. You can get through this, and just lean on supports, and know that they're there and there's a reason they're there. And I love Ted Lasso, so he made my closing slide. You have to believe in a positive opportunity, or else what's the likelihood of this ever going to happen? And that's it.